Welcome, everyone. We'll just give it another minute as people get signed in. Okay, why don't we get started? Welcome, everyone. Thank you for joining us. I am Anthony Carpi. I'm Dean of Research at John Jay College, and I really appreciate you all joining us for what I know will be a really interesting and exciting session. This is the second season of our Racial Justice Research and Practice Dialogues, and I'm really excited to keep this conversation going. I want to first start out by thanking the OAR staff who really made this possible, and especially Dan Stageman, who, despite some staff, despite the fact that we're down on staffing in the office, he was able to pull this together and organize this, and I really appreciate that. A number of months ago, Dara, Byrne, and I were having a conversation about this series and some of the things going on around the college. And she raised the idea of recovery, inequity in recovery in communities of color. And that really was the birth of the idea to focus this season on that subject. So this season, we will be hosting, we hope to host up to 3 panel discussions over the course of this academic year focused specifically on recovery and communities of color. I feel it's so appropriate in so many ways given the moment we're in. Today's session, we're focusing on racial equity in community recovery, CBOs, NGOs, and government collaboration. And I'm going to ask our speakers to give a short introduction of themselves. First, I want to welcome Kim Burgo.
Yes, hi everyone. Kim Burgo. I'm the Vice President for Disaster Operations at Catholic Charities USA, which is based in Alexandria, Virginia.
Thank you, Kim. We also have Craig Fugate. Craig?
Hello, everybody. I served as the FEMA administrator in the Obama administration in both terms, and also served on the Biden transition team overlooking Homeland Security and FEMA. And you know, currently I do a lot of stuff in the private sector, consulting and advising.
Great, thank you, Craig. And finally, Jason Rivera.
Hello, everyone. My name is Jason Rivera. I'm an associate professor of political science and public administration at SUNY Buffalo State. I coordinate the public management track of our MPA program, and I coordinate the Disaster and Emergency Management Certificate Program.
Great. Kim, Craig, Jason, thank you so much for joining us today. We really appreciate you being here. And this session will be hosted by 2 of our colleagues, Warren Eller. Warren's the chair of our Department of Public Management. Prior to that was a faculty member at Texas A&M and brings with him a long history of research in disaster management, and also co-hosted by Dean Dara Byrne. Dara is Dean of Undergraduate Studies and Undergraduate Retention. And on top of all the work she has had retaining students over the past year, she has also managed to both raise a daughter and get a degree, a certificate degree in emergency management studies. So with that, I will turn it over to them. And thank you all.
Hi, everyone. It is an absolute pleasure to be here and to co-host this discussion with this amazing panel. You're in for a real treat today as we cover a range of topics led or informed by the expertise of Dr. Eller, who really helped to shape this discussion. I'm going to start us off because we have 9 really dynamic questions for the panelists before opening it up to the audience. So it's a lot to cover in a very short space of time. So I'm going to take the first question. And the question is really directed to you, Dr. Rivera. As we explore the dimensions of DEI and social vulnerability in disasters, could you give us the scope and breadth of what exactly this might mean?
Thank you for the question. So when we were talking about social vulnerability in specific reference to disasters, right, we're really kind of referring to a community or individual's ability to be resilient from a wide host of natural or human-induced events. And when we're talking about social vulnerability, I would point those people in the audience or those unfamiliar with the work of Susan Cutter and colleagues, because they've developed a social vulnerability index, which is really a composite variable for geographic locations to see how socially vulnerable geographies are to disaster situations. Now, social vulnerability is not only just conducive, is a conducive variable when we're talking about disasters. Obviously, it can be used towards a number of other social science phenomena that we're always interested in. But when we're talking about social vulnerability to disasters, part of the characteristics or the factors that go into individual or even community social vulnerability include things like poverty status or the concentration of poverty within a geography, income status of individuals, educational attainment, for example. But there's also things associated with individuals or households, such as assets, right? So does a home have access to or to a working, and working is the preferable term, working vehicle, for example, as a means of not only being able to access disaster recovery resources or preparedness resources, but also just to get by on a daily basis, which is also a function of social vulnerability. But home ownership is another composite or another aspect of assets, in addition to financial savings that someone may or may not have. Obviously, when we're talking about social vulnerability, one easily identified criteria is obviously proximity to an actual event, right? Do I live, for example, or is my community located in a high hazard area? Do I live, for example, in Southern Florida, where hurricanes occur quite consistently? But then we also have other factors such as social capital, right? Bonding, bridging, and linking social capital that has been seen to either enhance or detrimentally affect individuals and communities' ability to be vulnerable or be resilient from disaster agents. But when we're really talking about diversity, equity, and inclusion, one of the things that we always have to remember is access to governmental and third sector organizations, in addition to the equitable service provision that these entities are supposed to provide. This was really brought up last week in the U.S. House Committee on Homeland Security. Their hearing on ensuring equity and disaster preparedness, response, and recovery. And one of the main takeaways that they talked about in this hearing last week was that in order to deal with or provide equitable services to everyone across the country, we have to have a better understanding of what these communities need and what the vulnerabilities of these communities actually are. But when we're talking about this, we have to emphasize the equitable accessibility to services and these entities. We also have to remember that social vulnerability of individuals or in communities are not inherent. Our vulnerability, if you are part of a historically marginalized group or community, they are not inherent things that we are born with, but the byproduct of policies, legacies of policies and institutions that have created social and political environments that have created vulnerabilities or created these individuals or these communities to be vulnerable. Now, when we're talking, and as I said before, when we're thinking about socially vulnerable groups, there's a variety of groups we typically think of. We, as this panel is here to talk about, it's obviously racial and ethnic minorities are part of this socially vulnerable group. But we also have to remember there are the elderly, there are children, there are the institutionalized, there are those in poverty in general, and the historically marginalized, in addition to the disabled. And when I say those in poverty, those that are historically marginalized, although within the rhetoric of disaster and emergency management studies, especially in the sociological field, we tend to emphasize racial and ethnic minorities. But when we're talking about those in poverty, when we're talking about social vulnerability, we also have to remember it's not just exclusively dictated by race and ethnicity. And so being very thoughtful about these things. But as I said, social vulnerability is also the manifestation of the intersectionality of all these things at once. So although we typically talk about what is it to be socially vulnerable and Black, or what is it to be socially vulnerable and elderly, it is also a byproduct of what does it mean to be, for example, socially vulnerable if you are African American, elderly, and have dependents you have to deal with. And with that, that is not the entire scope and breadth of what it means when we talk about social vulnerability, but generally speaking, we are talking about how these types of communities are able to be resilient in the face of adversity. And we'll talk about a little bit more about how that interacts with governmental and nonprofit entities today.
Thank you so much. Warren, I'm going to turn it over to you.
Administrator Fugate, Director Burgo, would you guys like to address anything that Jason said there before we move forward? Or
Well, this is Craig. If you look at who dies in disasters, the disproportionate number are elderly and people with disabilities. And as was pointed out, communities of color, African-American communities historically have higher levels of poverty in certain parts. But the financial stability and the financial resources people have, just simple things that we just take for granted. Having a credit card could mean the difference between being able to self-evacuate or not being able to. Choices people have to make, as we saw with Hurricane Ida, who could leave, who couldn't. Usually comes down to who had a car, who had money to buy gas, who had a credit card to get a hotel room. So these, are not just, people talk about generalizations. These are very specific issues that people run into. The lack of financial resources to deal with the disasters. And as we talk about trying to build resiliency, I caution people and say, look, we're having trouble just giving people the tools they need for everyday survival, and then expect to build on top of that, being able to respond to disasters. And I think we have to really focus on, if the communities are not resilient before a disaster, we're not going to sprinkle any fairy dust and make them resilient during and after the disaster.
Yeah, I absolutely agree. And certainly to add to that, we've got people with realities, and these realities takes $1,000 to evacuate a family of 4 for 3 days. Where are you going to get that when you are living paycheck to paycheck, or you don't have enough money to cover the food bill? So you end up staying, you end up certainly bringing more harm to yourself and exposing your family to things that can be harmful as well. I think to the disaster response without a lens to the social determinants of health is something we always need to keep that in mind too, because as both Craig and Jason said, it's their realities that come into play with all this.
Warren, you're muted.
again, I sound best muted. I'll say the technology was working in everyone's favor there. I think those responses actually have given us a pretty nice segue. And Administrator Fugate, I'd like to direct this next question to you. And what was a phenomenal talk, actually. In 2009, I think about 25 minutes after you took the job as FEMA administrator, you addressed the natural hazards workshop in Boulder. And during a Q&A session, you responded to a question about putting individuals into positions in your administration. And your response to that was, I'm going to do that because it's what I have to do as part of the job, but that's not going to fix the problem. And paraphrasing, your response was, we're not going to fix the problem until these communities are part of the plan, not an addendum to the plan.
Yeah.
And I was wondering if you can sort of build on this, because I think it's a brilliant heuristic.
Well, listening to the opening, who all is the program that we developed for recovery not helping? Children, small infants, the elderly, people with disability, low-income communities, communities of color, the undocumented, which is another population that is totally vulnerable to disasters and yet have little or no rights for any assistance from the federal agencies. And I was faced with this with Save the Children, who came to me and says, we need to write another annex in the plan for children in disasters. And I'm like thinking in my head, and I'm like going, wait a minute, we've got more people in the annexes than we do in the basic plan. So who did we write the plan for? And this is where a term that we created, I didn't create it, a team there at FEMA created, called whole of community. And it was quit planning for what fits the plan and plan for the communities you live in. And quit putting children and people with disabilities and poverty and all of these categories that we were saying hard to do in an annex, and go, that's your basic plan. You need to be addressing these populations on the front end. Every time we find a group that we try to bolt on in an annex, we're identifying the plan isn't working, but more importantly, we're not really addressing the underlying issues. And it was not a complex idea. It's like, we ought to plan for the communities we live in and quit making the community fit the plan we were willing to write.
I should probably quit hitting that mute space or switch, because I keep finding it hard to get it off. Kim, Jason, would you all like to tag onto that?
Yeah, I completely agree. It's great for us to make all these rules and regulations and guidelines and plans and ideas in Washington, D.C. But if it doesn't include the local community and how reality plays out, the whole thing is going to fail. There's internationally, I do hold an international background as well. And internationally, they utilize this program called the SPHERE Project. And it's a handbook for humanitarian disaster response and recovery. And within it, there's a specific section about creating your disaster plans and including the local community. This SPHERE Project is not active in the United States. And so I think that's part of it. It's not part of our culture. We think what's best and then we move forward. And so I completely agree. You have to be at the local level to understand what the local level is doing.
I completely agree with both Kim and Craig. I mean, the more democratic inclusion of groups within not only disaster management and the whole community approach, but also public administration in general, is something that we've been dealing with, at least rhetorically, for at least 20 years. We have within public administration, we have this new public service mentality, and then we need to be serving the public. But if we're not including them in the generation of public value, if we're not including them in the development of plans, I mean, my research more recently has focused on how do you engage in more inclusionary types of deliberative policy development. And right now I'm in the process of working with a colleague at Florida University of Central Florida, on looking at how emergency managers are including the public within the planning process at the county level. And a lot of times what county EMs are saying is that it's a byproduct of both statutory requirements of not allowing the public to know certain things, or that the public is perceived as not being competent enough on certain things to be valuable in those discussions. And also there's always the notion of, well, who do we include from the public, right? Who's representative of the public? We can't obviously include every single person that lives within a jurisdiction. So who do we do that? And it's not the loudest person in the room that typically wants to be heard. It's the people that are truly representative, and trying to find those representative groups is necessary for pursuing that whole community approach to disaster emergency management planning, which granted, it's extremely difficult and time consuming to do, but in all honesty, that two-way deliberative conversation of learning from each other is the only way we're going to get there.
I think so. And as a good follow on, Kim, I've got our next question for you. That is, the NGO community, the larger nonprofit community, has a long and sort of storied history of filling the gaps in disaster response and recovery, very much being the group that fills these holes that we have. I flash back, I think one of the first times I'd worked with you was about the same time FEMA had tried to declare the American Red Cross to be ESF 6, which was an interesting sort of approach. I'd like you to speak a little bit about the intentionality of the faith-based community in sort of filling these voids in equity in disaster response, and what sort of challenges that community sees with that.
Yeah, thanks very much, Warren. Gosh, the intentionality, you know what, I see that the intentions for the non-government community and the government community are the same. We're all working in the same direction. We're all working towards saving lives, sustaining livelihoods, building civil society. We just have to approach it in a different way. You know, certainly FEMA has a number of resources that they come with, but they also come with some strict guidelines. NGOs, on the other hand, they can be a little bit flexible on those guidelines, but we don't have a lot of resources. So either way, if we're able to connect with each other, certainly there's plenty of disaster to go around. It is really interesting though, how does this play out in the long run? You know, NGOs are in the community for the life of the community. So when you are going on a blue sky day down the street and you see somebody on the sidewalk and you say, hey, here's the address to the local Catholic Charities office to get a meal. Well, guess what? So when it's your turn to get that meal, you're going to go to the local Catholic Charities office. So I always tell our agencies, like it or not, here you come. It's going to happen. But I think that one of the things that we learn is that post-disaster brings about a population of acute poverty, and that can lead very easily into chronic poverty. You know, Leah Boston, who's a professor of economics in Princeton, she released a study back in mid-2017 that stated that the rate of a local county's poverty increases by 1% following a major disaster. So I kind of checked it out, did a little more research, and certainly that's exactly what happened. Just in Houston area, Harris County, Texas, when Hurricane Harvey hit, it was the poverty rate was 13.7%. But after Harvey, it rose to 15%. And now after the pandemic, or as we're still in the pandemic, poverty has risen to 16.2%. So what happens? Harvey is way out of the media scene. And so guess what? They come to Catholic Charities. That population went from being in acute poverty to chronic poverty and has now added to the work of local NGOs to carry on long after the disaster is done. And the same thing, you know, racial inequity is just horrific. And certainly when a disaster hits, it exposes everything about it. There's no distinction between races when everybody in the community is hit. But certainly, Jumia Howell in the University of Pittsburgh, she did a study, 13 years of data to examine how people did or didn't recover after a disaster. And the bottom line is that she found in the study that white Americans who experienced natural disasters had the highest predicted wealth accumulation of any race or ethnic group, even compared to their equivalent Americans who may have not experienced a disaster, while Black Americans, on another hand, had the overall loss of wealth when they experienced disaster. And they found that many Black Americans in the study didn't own a home, they rented, they owned less accumulated wealth, they didn't have renter's insurance. And so really this racial divide has also played into our disaster responses and how we approach them. So, at the end of the day, when there's no assistance available to these folks, they come to Catholic Charities, and it's not just for 18 months, it's for 5, 6, 10 years.
Thank you, Kim. Craig, Jason, would either of you like to follow on with Kim's comments about the nonprofits and disaster?
Yeah, I mean, I think, my role at FEMA, and we in the state of Florida, is I looked at it as a partnership. And as Kim pointed out, there are folks they can help that FEMA couldn't. And this really gets to undocumented residents, where FEMA is prohibited providing any financial direct assistance to undocumented residents. And yet throughout Florida and throughout the country, they're being impacted. And Catholic Charities never had that. We in many cases just triage a community and go, if there's US citizens, maybe, which is a baby born in the US to an undocumented family, that US citizen can apply for FEMA assistance. But where there was no family member that was a US citizen, Catholic Charities would often step in. And I think, that was the thing I think we kind of learned in Florida from Hurricane Andrew, got reinforced with Katrina, is all of these agencies were not good at everything, including the volunteer agencies. So let's focus on what we can do and maximize that capability while the other groups fill in. And that's why I'm a big supporter of working through the National VOAD, which brings together a lot of the faith-based and a lot of the volunteer organizations to kind of do that teaming. So it's not just one organization. It's what's the best we can do for the people we serve by accenting what we're best at and not trying to do things we're not good at the duplication of groups that are better.
Yeah, I agree with both Kim and Craig. A lot of the work that the government entities can outreach are done by faith-based and community-based organizations or nonprofit organizations. The one thing I would add, though, is many of the organizations that do have a sincere and intimate touch with, for example, the immigrant populations or undocumented populations, or even just impoverished minority populations or groups of people throughout the country, are not necessarily the large, big organizations that we think of. They're not necessarily Catholic Charities or the Red Cross or Salvation Army, or even the big groups associated or in the VOADs. We have to remember that a large amount of these organizations are very small, low capacity, nonprofit and faith-based organizations that require some level of enhancement or organizational enhancement in order to do these jobs. Because as Kim said, once that community is gone, or their service population is gone, the organization goes as well. But in many of these cases, these organizations are the organizations that these groups of people reach out to in relation for either because that's the only thing they know, that is where their social networks are, or it's simply an issue of trust.
Byrne, let me pass this back to you for a little bit.
Thank you. This is actually a really great segue. The term resilience has been in popular conversation for the last year or more. And I'm just observing the amount of people that are describing what they think resilience and recovery might look like. But in the disaster management context, resilience is pretty specific, especially in relation to policy. So Administrator Fugate, and I'll certainly be happy to hear from everyone else as well, what should resilience look like from your perspective?
Well, I can tell you, we started out talking about resilience, and it was always about stuff, how resilient the power grid is, how resilient the water system is, how resilient communications are. And I'm like, folks, you need to start talking about how resilient communities are. It's about people, not the stuff. And you have to, and again, a lot of this is going to come back to, it's very much economic. If you don't have financial resources, you're a high percentage of renters, you don't have insurance, you don't have good credit, you're more vulnerable to disruptions in a disaster. And you're likely to hit tipping points that will push you into, as was pointed out earlier, long-term poverty. I know a lot of people in hurricanes in Florida stuff that thought they were middle class until they lost everything because they didn't have flood insurance or didn't have enough insurance, or they couldn't prove title to the house because nobody in the family had gone down to the courthouse, because going to the courthouse was not exactly something that a person of color would do in some communities. And they couldn't prove claims to their homes. And I think this is the part where we keep missing. We keep talking about resiliency as this, something out there. And I'm really going back to, it's about people. And as much as we talk around this, it's always going to come back to the financial resiliency. Do they have the resources? Do they have the jobs? Do they have a place to live? Can they afford to live there? I mean, I heard this term, managed retreat in the climate, something we're actually thinking about. I'm like, well, I got bad news for you. It's already occurring and it ain't managed. Is people are getting priced out of their communities through gentrification after each one of these disasters. And we're losing affordable rental properties at unsustainable rates. So if we're going to talk resiliency, we got to just cut to the chase and go, it really comes down to how resilient financially are families and communities for these shocks. And if you've got problems ahead of time, they're not getting better, and the programs weren't designed to address those. And as much as we would turn ourselves in the pretzel to try to get there, to a certain degree, Congress built FEMA to address the middle class with insurance as the primary recovery mechanism for most families, which leaves out entire swaths of our communities.
Thank you. Kim, Jason?
Yeah, just in addition to that, I think that resiliency starts with good mitigation, but not so much, I would say in addition to mitigation of infrastructure and those other areas that are traditional mitigation avenues, we have to really begin to start mitigating people, mitigating the causes and problems of families. If we know that people live in a trailer home that is in a trailer park that is in a flood zone and they flood every year, then why do we allow them to continue to live in that trailer park? And why is the zoning of the local city allowed to make that area a place of residence? And so I think if we start taking a look at what we do know about people in poverty and what we do know about the causes of why they're there, and start mitigating those situations before the disaster hits, we may have a better outcome, and I think families will become more resilient.
Thank you.
Yeah, I think when people hear the word resilience or resiliency, I think they immediately think of or in the vernacular, the ability to bounce back from a particular situation. And I think we need to start questioning, as Kim and Craig had mentioned, well, bounce back to what? If the base mark or the benchmark is to go back to a pre-existing social ill, well, why would we want to be resilient in some circumstances if it's going to create just a perpetual cycle of social vulnerability? We have to start looking at resiliency, recovery, or what contributes to these things as a wicked social problem. And it's not a fix that necessarily FEMA or the government can do just in relation to disaster management. It has to be more comprehensive social policy where we look at fixing issues related to all the variety of intersectional indicators of social vulnerability. And so when we talk, well, or at least when I talk about resiliency to disasters, well, I always have to wonder, okay, we have these benchmarks to say, okay, did we go back to a pre-existing state? Yes or no? Well, can we critically say that that is a good thing?
When I think one of the issues I think that we've talked about a fair amount today is that issue of trust and what trust means in disaster response. And let me direct this to you, Jason. Can you talk a little bit about the role of trust? And when I say that, it can be from survivor to government, from the vulnerable populations to government, to responders, to researchers. I know you and I have shared many of the similar experiences where people from FEMA or Catholic Charities or National VOAD are just so excited to talk to you because of things you've said before. So how about you go ahead and kick this talk off for us a little bit about trust?
Well, since you evoked a very emotional reaction, I'll start with researchers. So yes, EM officials are oh so happy to interact with very relatively critical scholars, right? So people that have created a precedent for writing critical things about not necessarily FEMA, but SBA, HUD, and also nonprofit and faith-based organizations. And I don't necessarily say that as a wide sweeping claim. I know my work would not exist without the interaction and participation of those groups. But I mean, there is some level sometimes of trust that has to be developed and rapport that has to be developed between the researchers and the professional community of which we study to attempt to create recommendations for enhancement of the system, the recommendations of the bureaucratic organizations, et cetera. And so, but that's an everlasting thing, although it's come up quite recently, or at least quite vividly in the eye of the public with COVID-19 and people's overt distrust of governmental messaging. Issues are related to disaster, trust of governmental entities and trust of organizations has been around for a long time. When I think about these things, I kind of go to Perry and Mushkatel's Minority Citizens in Disasters research, work done by Brenda Phillips, Michael Lindell, Hugh Gladwin and his work on Hurricane Andrew. And really looking at, especially in particular minorities, racial and ethnic minorities, but also what has already been mentioned, immigrant populations, particularly undocumented populations, their trust in governmental and other organizational entities is paramount to the way they individually, not only as communities, but also as individuals, decide or engage in decision-making. So when I'm thinking about how trust plays a role in how communities or even individuals act, I really go back to the economist Herbert Simon and his notion of bounded rationality, and that trust is a binding or bounding type of dynamic in the way people make decisions that may provoke individuals or even communities to act in quote unquote irrational ways from the perspective of emergency managers or people prescribing to a rational choice mentality. And this can be specifically or not necessarily specifically related to whether or not people decide to evacuate or shelter in place, right? It's not necessarily some crazy that's sitting there, well, the wind isn't going to blow me away. No, this is a legacy of trust issues with the government, with communication. Whether or not people seek immediate relief from governmental entities, as we had talked about previously, this notion, especially from undocumented groups, and a fear, whether or not it's warranted or not, of immigration coming in and deporting people, whether or not that's warranted. It is a byproduct of trust, not only in our government, but a legacy of the trust the violations of trust they had in their own home countries. This also is also in particular particularly important when we look at whether or not people apply for aid with individual assistance. some people, because of the lack of trust in government, just have decided, even though I may be entitled or qualify for these things, I'm not going to go through the effort. I don't trust them to actually give me the money that I'm interested in. But that is also contributes to governmental trust, right? One of the things that I have heard over and over again over the last 20 years is specifically from emergency managers is that the public has this very big misconception of what our responsibility is to them, what FEMA's responsibility is to them, specifically in relation to individual assistance, right? But trust is breached on the behalf of the public, or at least the perception of which is breached on the behalf of the public, because they perceive, or they have this misunderstanding that it is FEMA or the government's role to make you whole after the fact. And this, although it is completely not true, it is a violation of the public's perceived trust because this is what they believe. And and as a byproduct of this breach in trust elicits different interactions with governmental entities, both individually and at a community level. And the last thing I'll say just before I hand it off is that this is not only just when we talk about historically marginalized groups or racial or ethnic groups or people with disabilities or the elderly. This also pertains to organizations themselves, faith-based organizations, nonprofit organizations, governmental organizations. Trust is a major factor when these groups are trying to engage in planning initiatives, in scenario activities, etc. If, for example, on the nonprofit and faith-based side, if you have organizations mandated to come to the table, but they don't trust each other in this exchange, nothing much is going to come from this interaction, which foresees or forebodes horrible things when the disaster happens. Because if they're not willing to come together because of lack of trust in times of normalcy, what's going to happen when they have to deal with disastrous situations on the ground?
I
There's
think
that
what
whole
Warren
muting
means
issue.
is, I think what Warren means is, Craig and Kim, did you want to add anything to this?
Yeah.
Go ahead,
Go ahead.
Craig. No, I was going to say, you know, we have like there's so many levels of that trust issue, but it really does play out in the individuals that we serve. And just, you know, one quick example, we have a Catholic Charities client right now who's an African-American mother of 3. She was given information. She lives in HUD housing, and she was given information that led her to evacuate to Texas. And so she evacuated to Texas, where she found a small job, temporary place to live, and then she contracted COVID. So she couldn't work. She's now without a job again. She's trying to get food for her family and her children, and she couldn't meet the rent that she was making. So she was given an eviction notice. She was told that she couldn't collect anything in Texas because she was just there temporarily. And so she received this eviction notice. She was evicted and then informed that she had to go back to Louisiana. And she dutifully did. And when she got back, she learned that she was no longer available. She's no longer eligible for HUD because she carried with her an eviction. And so this information, whether it was given by people right, wrong, you know, in the right direction or not, you know, it becomes a problem. And there are more people like this going around in this, you know, soup that just gets stirred all the time that we're really trying to pull people out of. I do have to say too that, you know, I think for the first time, we all know there's 4 areas of disaster, right? There's natural disasters, complex disasters, human-caused disasters, and pandemics. And for the first time in 2020, we checked off all 4 boxes. We completely did. And so when we're sharing information, we have to take that into consideration. We can't just provide the information and the leadership on the disaster that's in CNN at the moment. We have to go across the board and take a look at all of the things that are happening. Like this poor woman, she got COVID, you know, that certainly hit the pandemic. She lost her food, she lost her house, you got the house crisis, the housing crisis, and the food shortage. There's all sorts of things that this goes against. So when we're talking about trust issues, we really have to take more than just the current event in front of us. It has to really be thought through on the information and the direction that we lead people in going forward.
Craig,
This
you
is
were,
Craig. Yeah, the whole thing about trust in government. Yeah, I joined FEMA in the Obama administration, and it was after Katrina, and everybody kept saying, can you promise that FEMA will do better next time? And I said, I'm not promising anything. First of all, if I tell you, you're not going to believe me. And second of all, we got to do. And I told my team, I said, look, quit telling people we're better or we're going to do a good job. People don't care about how well you did, it's how they were impacted. And so what I've learned is you need to go find your harshest critics and go sit down with them and listen. You don't have to agree with them. But I tell emergency managers, quit personalizing these as what you perceive as attacks when it doesn't agree with what you're doing or tells you you're not doing everything you should be doing or that you're missing opportunities. Because there's this tendency they get defensive and they personalize it. It isn't about you. It's about the people we serve. And we can agree to disagree. But the first step of building trust is being willing to sit down and listen. And don't throw up all the roadblocks or don't dismiss everything. Because when you listen, you start finding out things. This was pointed out just before. A lot of times our programs are written in a bureaucracy to simplify the administration of the program. It's not written from the standpoint of the person trying to get help. And I said, it would be really fascinating if government took the approach that we should have programs that adapt to the needs of the people we're serving versus making them fit our program. It's easy when they fit our program. It's easy to account for. I mean, Deanne Criswell, the administrator of FEMA, did something that I had done temporarily several times, but she just made it a policy. And this has been in the historically Black communities, predominantly across the South, but not limited there, where people couldn't prove home ownership because nobody had gone down to the courthouse and changed out the registry as the house was passed down family to family. Well, FEMA's policy was you have to have proof of residency to demonstrate you live there to get assistance. And without that, they said, we can't provide the program. I'm like, why not? And it was, well, it could be fraud. I'm like, we have the Department of Justice. If somebody's committing fraud, go arrest them. But quit denying people assistance because they don't have a paper trail that, quite honestly, there's nothing in the Stafford Act says you got to have a deed. If we have reasonable assumption, and I said, and Deanne, she did this. She said, if you'll decide an affidavit that you're a resident here and you're applying for the household, then we ought to be able to provide you individual assistance, even if you may not have a clear legal title to that property. And so FEMA made this, and Deanne's done this. And these are the kind of things that we ran into time and time again, because we try to make people fit the programs to make it easy to administer versus going, look, it doesn't work that way in disasters. And there are some limitations. Congress does have some hard stops. We can't provide financial assistance directly to undocumented residents. But short of that, in many cases, it's the program itself that won't adapt to the survivor's needs, trying to make people fit. And again, you run into all these hardships. I mean, the one time that I lost it was a mother and her son were living in her car, and they applied for assistance. And they were denied it because they were functionally homeless. And they were literally 2 weeks between being evicted from one location to getting a new place to live. But because they were technically homeless at the time of the disaster, the FEMA programs couldn't help. And I'm like, why? Oh, they don't have, they're not a homeowner, they're homeless. I'm like, this doesn't make sense to me. But those are the kind of things we ran into.
And let me follow up a little bit with our next question, because I think it speaks a little bit to some of the greater challenges that Greg just alluded to when he said Congress has their hard stops. And I'm thinking specifically of the nonprofit community. So Kim, let me ask you, there are a fair amount of federal, state, local requirements that always have to be met, not just in response, but especially in recovery. And that presents a pretty unique set of challenges to the faith-based community when they're helping engage in these sorts of things. Can you speak a little bit to how these sorts of accountability factors manifest as challenges in this sort of intersectional disaster response?
Yeah, absolutely. I think certainly the NGO community over time has certainly gained an education as to federal funding and how that works, the difference between a contract and a grant and all sorts of things like that. But I also think too that it brings about an opportunity for what I call the federal non-federal dance. And really, and it is thanks to Administrator Fugate, he really did forge the way to develop this whole community approach that did allow for resources to be shared. You've got to give here, this is what we need you to do. And, we need you at the local level to do this, but it's federal funding. So you got to play by these rules. So really learning the rules was a big challenge for us. So that didn't come easy, but certainly over time and with a lot of patience, I think that there are agencies within National VOAD. We certainly do a lot of work and have contracts with the federal government. I do think that we've learned that it's a different level of fund management. Certainly how you manage funds for a nonprofit is much different than the government level. Different ways of managing client information and how we keep our databases, and something as simple as different work hours. People in nonprofits will work for 80 hours a day if they could. And, the federal government says, oh, no, you gotta stop and do this. So really learning those do's and don'ts. I can tell you one very quick fun story about this was when we had an example. We had subcontracted to a Muslim organization that was doing disaster case management, and they did not realize that they couldn't put in a receipt for food. And so, but they did. And when FEMA, or I should say the federal government, got a hold of it and looked at it, it not only was a no-no because it was food, but it was a no-no because on there was marking for O'Doul's non-alcoholic beverage. And so immediately they tracked that as being alcohol, we can't do this, blah, and all the bells and whistles go off. Well, let me tell you, it completely almost started World War III, as this Muslim organization thought that the federal government was accusing them of poor religious practices. And all they were trying to say is, we're just going to reject this receipt. So it could be something as simple as that, or something is, that has taken some real morphing over time. This sharing of client databases, there's a lot of undocumented, as Craig said, that do come to Catholic Charities. They don't want their names given over to the federal government with any kind of surety as to what that is. And so we've really had to go back and forth and come to a consensus on providing aggregate data while the files are held of each individual person at the local agency level per se. But definitely it's the nonprofit government dance. We do it a lot better now than we did a long time ago.
Well, I'll sort of direct the same question to you, Craig, because I think you came in with a very different perspective, and I don't think people realize the big shifts that have occurred in FEMA over its time. But I think it was a good example of that was at the National VOAD conference in Orlando, where you'd said you'd quipped that you were tired of telling you how many people you had in shelters. You wanted to know how many people needed sheltering. And as I recall, there was a bit of a change in the voluntary agency liaison program under your administration as well. So could you speak to those challenges going in the other direction as far as intersector collaboration?
Yeah, when I got to FEMA, there was this tendency to look at the volunteer organizations as a necessary evil, but FEMA was very much in favor of what I call government-centric problem solving. They wanted to do it themselves or do it with their contractors and not be dependent upon the VOADs. And I'm like, well, I don't think you got enough money. And the second thing is VOADs are going to reach populations that you'll never reach. So quit competing with them and work with them. And that meant that for the National VOAD, I wanted to step up the game and too many times I found liaisons were the people you could spare versus the people that actually were decision makers. And so if we're going to be a true partner of VOAD, we had to have decision makers. I went to a fair amount of national VOAD meetings just to go in and say hi and say, what are we doing right and what do we need to do better and where are we still screwing up? And I was actually pretty proud of National VOAD expanded their membership, brought in a lot more what we would, I think, have considered non-traditional VOADs, some that didn't even exist when Katrina happened. Others were often out there but standalone, and the idea that we could do more together. So it was a change, but there were so many things at FEMA. Coming from a local level, state level, you talk about trust. At the local level, I never trusted state or FEMA. When I was at the state, I didn't trust locals or FEMA. When I was at FEMA, I didn't trust anybody. And what I'm saying there is, I found out that I needed to have eyes and ears on the ground to look for vulnerable populations, that they did not naturally come up through the system and get reported. The mismatch between what the state and locals were thinking was going on versus what community leaders were telling me was going on. My quip to FEMA was, if CNN can get there, why aren't we there? And don't go find the communities that are shouting the loudest. Go look for the communities that nobody's been to. And we changed things. FEMA was moving entirely in the direction of technology. Register everybody online, do everything through teleregistration, make everything impersonal. I said, you still need to go talk to people. And so we did this in Sandy, and we were doing it since. We put people on the ground to go into neighborhoods to ask people, have you registered? Do you need help? And actually go in. If the internet was up and we had bandwidth, we'd actually register them where we found them. We changed a lot of that, but it was this idea that we should adapt to the needs of the communities we serve, not make them fit our program. And I had a healthy distrust of official channels identifying vulnerable impacts to communities, that the underrepresented communities don't suddenly jump to the forefront in a disaster. And so I told our teams, I want to go find the places nobody's talking about. I want to go to the places that nobody's been to. I don't want to leave it up to the official channels to identify this. And we did a lot of this through NGOs, but as pointed out earlier, it wasn't the mainstream NGOs. A lot of times it was local faith-based churches, community organizations, people that knew somebody. And it's kind of interesting. We were able to take a lot of the campaign folks that had done a lot of community relations. And again, you got to remember, I worked for a guy who started out doing community relations, President Obama. So we actually had people that had transitioned from being on campaign, were now in federal government, that knew how to reach out to groups that weren't always on everybody's radar. And it became very valuable to go in there and say, I want you to call them and see what's going on. Not what the locals tell me. Tell me what they see is going on and where's the mismatch between what we are assuming is the problem and where the unmet needs were. And that paid dividends because in many cases, it got the problems much earlier. It didn't always mean we had a great answer, but at least we knew that there were issues out there that needed to be addressed.
So I think this is a great segue to a question that I have that I think is a common thread throughout the last hour that we've been speaking, which is the centrality of communications. Sometime last year or so, Professor Charles Jennings had a speaker to campus researcher, Professor Starbird, who looks at social media and communication and disaster context. Now, we already know that communications and disaster challenges in disaster context is extremely challenging. But her research was looking at the rise of social media and the additional layers of complexity that are happening in that area, particularly in relation to the spread of misinformation and disinformation. I'm going to start with you, Jason, and then hopefully all of the panelists will contribute. Could you talk a little bit about the challenges and opportunities you see here, especially in terms of communication and outreach? Administrator Fugate, you mentioned community outreach. the challenges and opportunities in relation to the use of social media and reaching disadvantaged communities.
I first like to start out with just reiterating what what Craig just said. It's about the communication is really about getting to the communities of which we're serving and figuring out how to do things better. As we had talked about before, communication or communication mediums are accessed differently by different demographic groups. And it's really among other things, it's a function of also, we were talking about trust, a function of trust, right? So some of the things that some of the people or researchers that I've mentioned before, in addition to FEMA itself and a number of other independent research organizations have identified it. For example, African-American communities access information about disasters from different sources. So for example, there may, even if it is accessed on TV or radio, the stations in which different minority groups tune in and trust to tell them information is different than what their white counterparts may access and trust. But beyond the electronic media, television, radio, social media, or whatever, there is still, especially in communities of color, in less accessible groups that are undocumented or even immigration groups, the communication really still is on the ground. Being able to access social network hubs, whether or not they be individuals or the organizations in which these communities or individuals frequently access, is also a manifestation of trust and its ability to disseminate the information that the government or NGOs or faith-based organizations want to provide them around the disaster that is either impending or that has happened already. One of the things that we think about, or at least what I saw when I was doing research with equitable distribution of aid and resources in Sandy, was that, yes, as Craig was talking about, people were on the ground, but there were also issues, at least reported from communities and also by the United Way, that there were issues in relation to accessing information linguistically, right? So although we have people on the ground, the availability of translators to reach and communicate with some communities is still a bit lacking, right? And so being able to deal with that, not only in the electronic sense, but also in the day-to-day personalized interactions that we have on the ground. Because again, communication can be politicized to the extent in which it can be very much targeted to certain groups, and also certain groups can be left out. Because if we know what groups are going to look at particular media channels, we can particularly target specific information in one place and not in others, or vice versa. But when we talk about social media, again, social media has provided us, especially in disaster response and recovery, has opened the door to the ability to find where disaster survivors are located, where they are physically inaccessible in some cases, has allowed people to communicate with their families to say that they are okay. And so the social media has provided a much needed benefit to the disaster response recovery process. However, like any other electronic communication situation, it's subject to the dynamics of technological breakdown. It's also subject to, as we saw over the last 6 years, subject to misinformation, right? And so not only can we, even if we rely on traditional trusted, I guess, networks or channels, there's also a risk of misinformation from not so well-meaning parties to send people astray.
Thank you. Craig, Kim, did you want to add anything?
Yeah, the whole thing about language barriers, people don't understand this. In New York, the amount of languages you're dealing with forced FEMA to do something you do for things like COVID. We actually activated the Defense Production Act to go in and basically take interpreters from a lot of already employed under contracts to bring them into the FEMA program. We found that in a lot of cases, we were doing local hires for second and third generational who were fluent in their languages in their community. And we would hire them just to be those translators and also to help, the trust issue. But I think social media, and I was doing social media when I got to FEMA and we weren't. I try to really get people to understand social media was not another megaphone to blast out press releases. It was actually an opportunity to do two-way conversations. And it wasn't the only form. And I think I said, first thing is you got to communicate with people on the way they get their information. I know that in some parts and well before social media, if I needed to get to Haitian Americans in Miami and North Miami, I had to get on certain radio stations because that's where they got their news. But there are still folks that, quite honestly, if it's not in the paper, it isn't news to them. All the way up to now social media and the demographics that change on that. So it was always about, my theory was, and this is a trust issue, we should provide factual information to people to make informed choices, that they're not going to do everything we think they should, and we shouldn't judge them on what they do or don't do, as much as we should be focused on giving them factual information so they understand what they're facing and they can make an informed choice. Because it's hard to say everybody should evacuate, given all the variabilities there. But we should give people enough information to know why they should be thinking about that or what they need to get ready. And it needs to be less of the parent speaking to the child, as much as here's information. What else do you need? What are we not clear about? What do you want us to do better? And listening to people when you give them that information. And there's always going to be challenges. There's always going to be misinformation. There's going to be fake stuff out there. We know that. But if you're not credible before the disaster happens, it's hard to be credible the day after.
Yeah, and I would add just a slightly different angle to all this too, is the importance of social media for fundraising purposes. When you're a nonprofit, you need every resource that you can get. And so certainly if social media channels are not there, or they're providing the wrong information, then the resources are very scarce. Just one anecdotal example, and really this isn't based on any research, but certainly something that we certainly noticed at Catholic Charities and with the agencies that are involved, was Hurricane Ida. Here we've got Grand Isle is decimated, Homa, all that area is completely decimated. And yes, there were parts of New Orleans that got hit, but that's where the media focused. And so the message came across, the levees held, we're okay. And so guess what? Nobody gave. Very, very little donations came in. And when 90% of your donations for a major disaster come within the first 10 days, and it's not there, what do you do? What do you do as a nonprofit when you've got people coming to you? So there's that other end of social media too, where it can be a help or a hindrance.
Thank you. I really appreciate the thoughtfulness of this discussion and how rich with research and on-the-ground examples that are coming from our panelists. We do have time for one question from the audience, and this is from Professor David Shapiro, and it's in relation to trust deficiency. Would enhancing and empowering local authorities in remediation and local capacity in preparation help to overcome, in part, the distrust among those served and underserved by the federal authorities? Anyone want to take this?
Well, that's the assumption they trust our local governments in the first place. And we've seen this where there are breakdowns of trust on a daily basis. Most recently, Black Lives Matters, the targeting and enforcement of that. That is something that in some cases we find communities want to get to the federal government because they trust the federal government more than they do their local communities. So I think there's it's again, a lot of elected officials are always wrestling this at all levels of government, is how do you communicate? How do you build trust? And I think that's the thing. People just can't go in and say, we trust me. You have to build trust. That means you got to put some effort into it. And it isn't easy. And it isn't going to be immediate returns on that. And sometimes building trust takes a long time when you have long-term history of the scars. So yeah, empowering local governments is great if they have good relationships in their community. But if they don't, you've just ended up, I think in some cases, taking away some of the channels people have when they say, if the locals and state won't do it, can I get to the federal government?
Thank you. Kim or Jason?
Yeah, I would just say that. Mute buttons off. I would just say that, you know, certainly Craig is right on the mark. I mean, there's no doubt. You really have to meet people where they are. If they trust their local church, that's where the information has to go. If they're not trusting of their local government, it's going to do more harm than good.
I agree. But I think it has to be, it's contextualized and situational in that. So actually last week I was speaking to some people that were doing some capacity enhancement for county EMs down on the Florida Panhandle. And one of the things that was noted was, if this empowerment and this capacity enhancement comes, or even resources comes to them, it has to be alongside information or enhancing their knowledge about the value of social vulnerability. And what I mean by that is, when people were put into a situation where, okay, so you're getting this, we're going to enhance your capacity along these lines. So financial education or knowledge, or what you can do with your assets and be more effective, or how can you engage in a whole community approach to planning. Well, there seems to be a political prioritization of neighborhoods or aspects of the community that, if you don't change that mentality among the EM office or the decision makers, that it doesn't matter how empowered they are or how much you enhance their capacity, they may still continue to neglect those historically marginalized communities, sometimes deliberately, but sometimes because they don't even acknowledge or understand that they are there. So for example, Craig just said that to reach particular Haitian populations, you'd have to go to a particular radio station. There was one individual who is dealing with a Haitian population and never even thought to talk to the Haitian radio station to disseminate information. And so for some people, that's like, what do you mean you didn't think about that? But for others, it's something that they have to be exposed to that information, educate the emergency manager. I think we spend a lot of time talking about, well, we need to educate the community on their vulnerability, on the community on what they need to do, as opposed to thinking that, you know what, maybe the other side is not necessarily fully knowledgeable of what community aspects are out there, what communities are out there, and how do you go about engaging them in the first place.
Fantastic. Unfortunately, because I've got a list of about 72 other questions I'd like to have you all sit around and talk about for a little bit. But unfortunately, that sort of draws our formal time to a close. And with that, I would like to, on behalf of John Jay and the Office of Research and the Department of Public Administration, thank you all for showing up for this. I think we could not have asked for better speakers. Following you all from afar for a long time. You all seem to be very straight shooters, as well as very, very well informed on this subject. And it was fantastic to have you be able to come out and share with us the way you have.
Absolutely. And this conversation is also really meaningful to the John Jay community. The students that we serve are coming from the populations that your work influences, impacts. And so we all appreciate broadening our understanding of what we need to do as an institution that is committed to student success and committed to seeing the students that we support thrive as they pursue their education while experiencing disaster in its many forms. And this conversation has really helped us to think more deeply about our practices so that we can really support our students for the long term. So thank you so much for being here with us and bringing what I think, honestly, is one of the most dynamic and thoughtful conversations that we've had on recovery, resilience, disaster, and vulnerability in, if ever, at the college. So thank you so much.
Everyone.